And the first one I have is for Dr. Speedy. Can you tell us why it's important for seniors to be involved in making their own healthcare decisions?
No kidding.
Hello? Okay. I'll let Maya answer this as well, but for me, I think the importance is it always important for anybody to be involved in their own decisions, right? We all have our own values and preferences. But I think particularly for older adults, as I think was touched on earlier, a lot of times your providers or your children or other people may kind of assume that they know what you want without necessarily asking what you want. And so it's really important to speak up for yourself and be involved in those decisions because nobody else will do it the same way you will.
Yeah, I'm kind of on the same page with that. So for me, this is kind of personal. My grandmother, she was in her 70s and had chronic kidney disease, so she was on dialysis, and towards the end of her life, she was in and out of the hospital a lot, and as a family, we always told the staff, you know, we want her to be a full code because we want her to be with us as long as, you know, she can. And one day she did code and they did resuscitate her as we had asked. And she spent several days in the ICU, and once she was out of the ICU, she was really frustrated and angry because that's not what she wanted. She didn't want treatment. She was tired of going in and out of the hospital. She was tired of receiving dialysis, but as a family, we thought, you know, we were doing what was best for her. But so that was just a lesson learned. If we had asked her, then, you know, maybe she wouldn't have had to endure that hospitalization and the chest compressions and all of that. So, yeah, with that to say, it's important to also let your family, you know, to let your provider know. If you are a full code, if you want everything to be done, if your heart stops, or if you want to be a DNR and don't want to be resuscitated.
Okay. And Dr. Spivey, what guidance would you offer children, adult children, who mean well, trying to support their parents, their aging parents, and making thoughtful healthcare decisions? I know sometimes they mean well, but what advice would you give?
Yeah, so first of all, that's great if people are coming with you to your visits, and it's to be commended that they're there for you and coming and listening and being a voice for you. I would just remind them that you are here to support your parents, not to dictate what's happening to your parents. And so making sure that they are considering things. A lot of times I will say this with finding like a power of attorney for you. Your power of attorney is there to support your wishes, not to make decisions for you. So that's kind of the main thing is making sure that your loved ones' questions are answered and making sure that you are keeping their priorities at the forefront. It's always good to bring up concerns that you might have because sometimes we all make kind of funny decisions and other people might give us some insight that we might not have. But to remember that in the end, it's really mom or dad's decision as to what's going on.
Okay. And then what role does preventative care play in successful aging? And what are the most important steps that a senior can make today?
Some of the most important steps that a senior can take to remain, you know, active would be to actually stay physically active, keep moving. Even light movement makes a big difference. Also keeping up, you know, as far as preventative care, keeping up with your screenings and also your vaccines like the flu vaccine and shingles vaccines and cancer screenings, colonoscopies, mammograms. Also, it's a good idea to review your medications with your provider or your doctor regularly. and then staying socially connected and paying attention to your mental health. And one last thing would be to talk to your provider and about what's the most important thing for you so that your care can match your goals.
Yeah, I agree. One of the things I meant to point out, and I didn't before, is that CHI is actually called an age-friendly source of care. And so that would be something to kind of look for. Is it age-friendly or is it geriatric-specific? But this is kind of a template of what age-friendly care kind of looks like. And you're welcome. I brought some of these. It's just a little trifold. It says care for your future health. It's out on one of the tables. And whether you see me or another provider, it's kind of a good outline for how to talk about the things that are important to you. So it goes over the 4 M's, and the M's are what matters. The next one is medications. The third is mobility, and the last is mood and memory. So it kind of says what matters to me is medication issues I'd like to talk about are, mobilities I'd like to talk about are, mood and memory issues I'd like to talk about, and it gives you a little place to kind of write those down. And so I think that would be a good place to start if you're not sure what questions you have, is to fill out something like that to bring with you to your visit.
Great. Before we open it up for questions and answers, is there one piece of advice you would like to give, or anything else that I didn't ask you in your questions that we might have missed, or anything else that you would like to share before we open it up to questions?
I don't know that I have a whole lot. Thanks for all the great questions that you provided.
Thank you guys for all being here. I would encourage you to keep coming to Savvy Seniors and other groups in the community to be more informed, about your healthcare choices and what's available in the community for you.
Okay, great. And who is it that's going to pass around the mic today for questions? Did I ask somebody? Belle will help, okay? And Belle is from Caring Friends, and she's going to pass around the mic. So just raise your hand. We want to make sure that we get all the questions asked with the mic so that everybody hears those questions.
This question is for Mary. You said you're from CHI.
Hold it closer to your mouth, we can't hear you.
This question is for Mary. You said you were from CHI Health. And are you allowed to practice at the Bryan Health? If we would end up at the Bryan Hospital, would you be able to come in and visit us if we were hospitalized because of the practice issues of different hospitals?
Yeah, so I would have to be credentialed at each hospital that I would go to. So I currently am just seeing people as an outpatient. I'm not doing inpatient consults, so it's more for outpatient management. I do work at CHI St. Elizabeth's once in a while, but it's not in my geriatric capacity. It's just as a doctor working on the floor.
And same for Maya then, would you be in a functional clinic? Would you be able to come into Bryan Health and visit your clients if they were hospitalized?
Yeah, kind of the same thing. I imagine I'd have to be credentialed to go into any of the hospitals, so no. But we do try to keep in touch with our patients, whether it's stopping by to the hospital and seeing how you're doing, maybe not, treating you medically there, but also knowing what's going on during your hospital stay, and then also following up with you after you're hospitalized.
So does the Epic system help the doctors that are hospitalists in Bryan find are you on the Epic system?
Yes, so we do have access to the Epic system and the CHI system.
Yeah, I would add to that. So I can see patients who are primarily seen by Bryan. So regardless of who your primary care is, I'm open to whatever insurance you have. So if your insurance is covered, you can come see me. in terms of inpatient hospitalizations, I have a lot of people call me and say, hey, mom's in the hospital, can you kind of keep an eye on her? And I can kind of watch because there's the link between Epic, kind of what's going on, and I always welcome people that if you want me to talk to the providers in the hospital, I'm happy to talk to them. I can't dictate the care that you get there, but I'm always available for them to call if they have questions or to help coordinate follow-up care.
My question is more a comment, and I don't expect any hard-fixed answers because it's a hard question to answer. My wife developed dementia over many years. She, like many other people, and I guess I'm talking to everybody here, refused to announce care and refused to get treated or diagnosed. She's now in a nursing home in the latter stages of dementia. How do you get a recalcitrant person to where they will get evaluated? I mean, she was adamant that she was not going to get evaluated, and I saw her start slipping. Didn't know what it was for several years, and then it ultimately wound up with dementia. It seems to be and I work with Alzheimer's people for awareness. I have tended that table at several Savvy Seniors meetings where people have come by, picked up the literature, and I give them the 10 warning signs, and they say, I don't want to know. And that was my wife's commitment. She had what she called the white coat syndrome. She didn't want to be around doctors, period. How do you address that? And I'm talking to everybody here. How do you address that if it's one in your family or one of your patients? Because of that, I go to a neurologist every year to see where I'm at on the spectrum off of my baseline.
Yeah, that's a great question. It can be really hard because we always want to enable people to make their own decisions, right? But when it's someone you love and care about, you want them to get the best health care possible. So like any disease, it's important to catch it early so that you can kind of put some networks in place and kind of work specifically on maintaining as much cognitive health and getting some extra resources like PT and occupational therapy to kind of help optimize your health overall. A lot of times when people come to see me, I'm a little less scary than a neurologist because I'm just a geriatrician, and so sometimes people will come and I say, you know, I want to have a sense of where your cognition is. I talk a lot about there's multiple different reasons to have cognitive problems that aren't just dementia, and if you have one of those reasons, it's really important that we find it out so we can get rid of it so that you can think a little bit more clearly. I talk about even if you do have dementia, if you have some of these other risks, then we can optimize your dementia by getting rid of it. So different medication side effects, different vitamin levels, if you've had any brain injuries or strokes or things like that. And so I tried to take it as kind of a holistic approach and talk about it more as how your brain is working. I know dementia is a hard word to say. I do try to get it out there because I want people to be clear that that's kind of what's going on. But it's really hard, and people really grieve that process. There's a really great magazine by Mayo Clinic. Let me see if I can pull it up. That talks about dementia that I bought on Amazon. I saw it first. First, I saw it at Target, so I was really excited. I bought a bunch of copies for my office, and then my copies kept disappearing. So I had to buy more. Let me see what it's called. I'll let you answer. Yeah.
That was an excellent question, and it's again, that's why these kinds of talks and groups are important, because sometimes with memory loss we try to attribute it to aging, you know, and that's a normal part of aging. And while there are some things, you know, that do come with aging and some memory loss, some things are normal and some things are abnormal. So again, the importance of preventive care, having your regular checkups with your provider. We usually do a cognitive test at one of our initial visits, and sometimes people, you know, can ask me, well, I don't have a problem with my memory, or why are we doing this test? But we use it just, you know, as a baseline to check every year how you're doing, or say you get a normal score, and then in a few months, you know, we're concerned about certain things, or your family's concerned about your memory. We can repeat it and kind of see that gradual change.
Okay, so this magazine is from Mayo Clinic. It's called Living with Dementia. And it has a really great, and it's probably way too small to see, but it has really great information for both caregivers as well as the person in early stages of dementia. You can kind of read it and learn what's going on. It also talks about helping transfer people if they're having difficulty transferring from different places, from the chair to the bed or whatever. And it talks about kind of end of life and advanced care planning, which we didn't touch on a whole lot here. But it's a really great resource. I've given it to a lot of people. It's like $15 on Amazon.
We'll have you back on our end of life topics.
Okay, perfect.
Do you have another question?
Yes, I have a question about insurance. I noticed when I turned Medicare age that all of a sudden, a lot of places wouldn't take me anymore as a patient. Have you guys noticed that? Yeah. So I was curious, from the two of you, do you know, does your facility take Medicare, Medicaid? I mean, what insurances will you accept?
So CHI Common Spirit takes all insurances except Aetna. So I don't know why that is. Well, you know why. It's contracting, of course. But I take Medicare and Medicaid for sure, yeah.
So Archwell Health takes the Medicare Advantage plan. Medicare Advantage, that's the only thing that we
I do
do.
not need the microphone.
I remember you. I remember you from another talk about dating. I remember you. I got
Oh,
you.
yes,
Okay.
I could talk about that too.
We need the mic.
We need the mic. Okay, Stacy, you need the mic.
Okay, if I stand at one end of a football field, you can hear me at the other end, but I'll use the mic.
It carries around the room better.
Yeah.
Okay. I have a doctor that will not answer my questions and has put down a diagnosis for me that I know is absolutely wrong. I need a different doctor, don't I? No answer? I think I need a different.
That's a loaded question.
I would address it first with your provider and ask the question and the reasoning for the diagnoses. But if you don't get an answer, then yes, I would keep kind of climbing up the chain of command and maybe asking the clinic manager or someone else to see if they could help you with that.
I think I need a different.
Yeah, I think if you are finding that you don't see eye to eye with your physician and your questions aren't being answered and they're giving you diagnoses that you don't agree with, it's perfectly reasonable. Even, you know, if you see a specialist and you don't agree with the specialist, get a second opinion, right? If that doctor also says, yeah, you have this diagnosis, then maybe it's a valid diagnosis. If you're sure it's not, then if you see another doctor and they say no, then you say, oh, well, that's what I thought, and you can kind of go ahead with that. But yeah,
I knew I needed a different doctor.
it's fine to get another doctor.
Just go talk to Dr. Spivey.
Say that again, Bill?
Just go talk to Dr. Spivey. She'll
Trust me, I'll be on the phone, getting an appointment.
Did you guys have anything to add as far as like Archwell and the type of insurance?
That previous question about, you know, yes, we only take Medicare Advantage plans with United Healthcare.
Let's get him the mic here real quick.
Yeah, so back to the previous question. So we do take Medicare Advantage plans.
Hold it up to your mouth.
Medicare Advantage plans with United Healthcare, Aetna, and Humana. And if you're on dual plan, if you're on Medicaid as well, that's perfectly fine. But the first step is the Medicare Advantage plans through those companies. That's what we accept right now.
Do we have any other questions?
Yes.
Okay.
Okay, I'm 75. I think I'm in pretty good health. I noticed that I'm not quite as physically stable as I have been. And I'm having shoulder surgery in a month. I'm interested in having a baseline. If I came to you and wanted just an assessment, given that I don't have any particular issues, would that be covered by Medicare? Okay. And quick question, what's the difference between a geriatrician and a gerontologist?
That's a great question. All right, so a geriatrician is a geriatric doctor. Specifically, I'm a geriatrician. A gerontologist is someone who learns about geriatrics, and so you could have a physical therapist who's a gerontologist, a social worker who's a gerontologist. It's not wrong to call me a gerontologist, but more specifically, I'm a geriatrician.
Thanks.
I'd just like to add something that people are very reluctant, in my experience, to get a second opinion because they think they're going to insult their doctor. And I just want everybody to know that at least Medicare Original, I don't know about Medicare Advantage, will cover second opinions. So you're not on your own. You can do this. It's acceptable.
And if your doctor has insulted you, you have a right to insult your coworker.
Just a real quick, two questions, one for each of you. Dr. Spivey, you said CHI doesn't take Aetna, that's been a battle for the past year almost now. Do you bill through CHI, or can you actually see patients that have Aetna outside of the CHI window? Is that something that you're able to do?
Anyone is welcome to come as a private pay. So I can see people. I don't have other coverage through any other, I can't bill separate from CHI, I guess.
Okay, that's the question there. And I just want to make a note, you said something earlier, your favorite thing to do was to take people off medications. I super appreciate that. My mom passed away at a very young age, and she was on almost 30 different medications, half of which I'm pretty sure she didn't need. Super appreciate that. Maya, do you guys take VA?
That's a good question. We do. Rodney's shaking his head.
So, great question. So yes, if you remember the VA, if there are Medicare Advantage plans that are tailored for veterans, if you're on a Medicare Advantage plan, yes, we can take receipts, lots of veterans, absolutely. And that can work hand in hand with the VA. If you still want to go there, that's fine. We will be your civilian doctors, if you will, a second option for you. Yes, we see veterans all the time.
Any other questions? So how do you feel after hearing all this today? Are you feeling a little bit more confident in your healthcare decisions and your choices? Or you might be relieved that you do have some good flexible options out there. And we just want you to know that you are valued as a person, you're unique, and hopefully you'll be motivated to take the next step. So what are some steps that you can take today? You can review your current health plan. Is it still a good fit for you? Ask these questions on an ongoing basis, and I think those are something our panelists would probably agree with. Make a list of your personal health care concerns and make those your health care a priority. And meet with your physician, your trusted advisor, and explore your options and see what your doctor, your primary care physician has to say. And how many of you have a medical go bag? Things that's a bag or folder that you would take with you in a crisis that has all your information, your medication, who all your specialists are, your next of kin, what you want done with your pet, all that kind of stuff. If you don't have one of those, that's going to be a workshop that we're going to provide here pretty soon.
Good.
Good. And thank you, Mary. So we want you to just encourage you to talk to your family, your caregivers about your wishes and get these conversations started so that people know what your plans are. Just in case there's something happens to you and you can't speak for yourself, you can still have your wishes carried out. So with that said, we are going to have our educational partners come up, and we want to introduce our educational partners to you, and they're going to tell you a little bit about who they are and what they do and what services that they provide, and any announcements or special events that they might have coming up. So why don't we meet over here? You still have a mic, Val? Oh no, here's the other mic. And they also have some goodie baskets, and we'll have to give baskets away here. We're going to go ahead and start with you, Dad.
Okay. So, hey, so you need to mark June 26th. June 26th, put it in your calendar, put it in your cell phone, write it on your hand. I don't care what you do. But on June 26th, we're bringing in a John Denver tribute artist from Seattle, Washington. His name is Ted Vigil. We have cards out here. You can pick one up, but he looks like John Denver. He sounds like John Denver, and we can seat 2,000 people. We expect it to be full. It's a free will concert. First come, first serve. Once we fill the auditorium, our seating, we'll have to shut it down. We are raising money to build beds for Sleep in Heavenly Peace. You might have seen the piece on Channel 8 or on ABC Good Morning America. This is the national organization. We're building beds for kids who are sleeping on the floor. Lincoln, Nebraska has 25 zip codes. In 8 zip codes in Lincoln, Nebraska, in 8 zip codes, there are 8,800 kids sleeping on the floor. And we're going to do something about it. We're going to raise money. We're going to bring Ted Vigil in. We're going to raise money, and we're going to build beds for these kids and get them off the floor. So tell your friends, come and hear this guy. He's fantastic, and help us do something for Lincoln.
You got flyers out there?
We got flyers out there.
So come, bring your friends, bring your pocketbook for a good cause. Hey.
I'm Val Edom. I'm with Caring Friends In-Home Care. We're a non-medical in-home care service provider throughout Nebraska. We cover 30 counties from Lancaster County all the way west to Binkelman, southwest part of the state. We service about 250 clients from pediatric to geriatric, so it doesn't have to be a certain age limit. We do non-medical cares, and this is my way of saying what we do. We care for people with like what your mom would do for you. You cook, you clean, you help bathe, you help dress. Those are the things that somebody's recovering from an illness or injury that might need help with that. Somebody who has some decline physically, what they can and can't do. Children with disabilities, we help those individuals as well. Somebody with maybe a stroke or traumatic brain injury, somebody who needs help with cognitive abilities. We actually do attend medical appointments as well as an advocate, and I love that conversation that we had today about advocacy, because I believe I have older adult parents who are, I go with them and I ask the questions, and I believe it's the right thing to do to ask, what does this mean for me? What is the outcome? How much is it going to cost? Now that I have this procedure, what will my outcome be? I want to know what my alternatives are, and knowing you can ask questions to go to a different provider if you're not happy with the services from your current provider. So I think my parents are of the generation where they do as they were told, and they just follow those orders, and I'm not. So I like to challenge a little bit. Maybe I'm that girl, but I believe in asking those questions. So at Caring Friends, we can be that advocate for you. We can go with you to your appointments and attend those things. But we'd love, if you have a question about our services, just to come out and get a card and follow up with a conversation. Are we supposed to bring our prize up here?
Yeah.
Okay, well, I have a Caribou coffee or Caribou whatever smoothie, whatever you want, $20 gift card in this little card here.
I'm Rodney with Archwell Health, and I really don't have to say a whole lot more. Maya did a beautiful job today. Thank you. So the best thing I could say, a couple things to kind of go on. I think there was a question asked about, do I have to call my doctor if I decide to change? No, you don't. Spend about 15 minutes with myself or Taylor or Jose. We will be there with you to call your insurance company, let them know you want to change primary care. We will get all the records from your previous doctor, and the insurance company will let them know. You don't have to have that uncomfortable conversation if you don't want to. So we'd handle that for you. As far as my sales pitch, if you come join us, you can spend an hour with Maya. So I think that's worth it. So thank you so much for having us today. Oh, my bag here. We've got, I've got a couple insulated mugs, 2 of those in here, and then we've got some licorice, and then a $25 gift card to Super Save Our Neighbors. So.
Hi, I'm Bert Quinlan. I'm a volunteer with Alzheimer's. I'm here because primary person is on vacation. I'm a caregiver for a wife with dementia. The only thing I can say is we're fundraising all year long. Information out of the table. 800 numbers to call, plenty of help, referral service, and as I mentioned when I asked a question from the floor earlier, if you or some of your friends or relatives think you have a problem, or if you don't and need to establish a baseline, you know how to go about doing it with either a neurologist or Mary or somebody else, but it's important that you get evaluated, which my wife did not do, and I, because of that, because I don't want my kids to have to deal with it, I get evaluated every year against a baseline for the last 3 years. I have a package over here of tabletop decorations for the 4th of July.
I don't know if you want to talk a little more about this, but I am familiar with Alzheimer's Association, and they do have a recognition in June 21st, the longest day, regarding caregiving and what it's like to be a caregiver for somebody with dementia. It is a endless
and a walk in October.
And a walk in October, but June 21st is the longest day. They celebrate the summer solstice, so you know that's the longest day of the year, but it's to recognize the caregivers and who do care for dementia.
I am Kelsey Hutchison with Oasis Senior Advisors. We are a free resource for seniors and their families to utilize when it comes to thinking about a plan of care. Maybe you are curious about companion care, maybe you're curious about home care, home renovations. We can help link you up with those wonderful resources, such as Val and her team, or other community partners out there. Also, if you're maybe looking for a community in the future and you're curious about what those cost or what do they look like, they're very different than what maybe we're used to, especially in our rural parts of the state. They're very different. Apartment style living, things like that. So we help walk through your budget with you, take you on tours, ask the right questions, and just look at what's even offered, what's possible. Or if you want to stay home, we help set you up with those services as well, and what's possible in that space. We have a fun little patriotic wreath for 4th of July or Flag Day coming up next week, I believe. So yeah, thank you. I'm Kelsey with Oasis Senior Advisors.
Hi, I am Susan Langford. I am from Sage Living by Tabitha. We are a 55-plus senior living community in Lincoln. We are a fairly new facility. We're only about 1.5 years old. So, talking about today's topics and our expert panel today, aside from our beautiful new building and all the great amenities and the beautiful kitchens and green spaces and all those things, the reason that Sage Living was built was to address loneliness and isolation with seniors as well as college students. You may know that we are an intergenerational community, so we also have college students living in our community, particularly Bryan College of Nursing students. But again, the whole reason, the whole model for our community is to address that isolation and the loneliness in seniors, which, as we learned today, is detrimental to your health just as much as some of those physical ailments. So we have a great variety of opportunities to be involved, to be social, to be enriched in many different ways. So if you have any other questions, you can always reach out. And today I brought Nothing But Cake gift card.
My name's AJ with Lucky Dog Property Solutions. We do handy home fixes here in Lincoln and surrounding community. So electrical, cabinets, carpentry, plumbing, all the things above and beyond all that list. So if you ever have any questions or anything like that, I'm more than happy to give you some information, or if I can't help you, I have a huge list of resources here in town, from licensed electricians and licensed plumbers, those types of guys, as well, that do really, really great work. So if you have any questions, just give me a holler and we'll figure out what we can do to help. I cheated today and brought 18 fresh eggs from my chickens. So, right, I know. With some coffee and a little treat as well. So thanks so much.
I kind of want those eggs. Alright, I'm TJ Krass. I'm with the Nebraska Real Estate Specialty Group. We are the founders and the organizers of Savvy Seniors. And we are here to help you guys to any type of transition. We also help with checking out your house to see if maybe you can do something to age in place for a little bit longer. We're all about transitioning into the right place. You aging in the right place that's best for you. So all of the situations are different from person to person, and we can help you kind of guide you in that decision. And we do kind of act like a hub. If you do need to make a transition, we are full service. We can help you depending on what your needs are. We can help you organize some downsizing, some organizers to come in and help pack you up, all that kind of stuff. So and we're going to be giving away a ticket to the Savvy Senior Prom. So $40 value.
Okay, and we need to have, did we get all the evaluations picked up? Well, TJ and Rodney maybe pick up the evaluations.
I already got the evaluations.
So while we're doing that, Susan has a basket, and these are just little thank you gifts for people who brought a friend who hasn't been here before. So, and I forgot to do this last month. So this month or last month, if you brought a friend who had never been here before, raise your hand and you can get a little gift out of the basket. And then we will go over here and we'll get started on the drawing. You want to get the evaluation, we'll let our panelists pick something. Okay, so the first one we're going to give away is the gift from Caring Friends, and that is the mug with the gift card right inside now. Okay, so if you guys want to pick one of those. Elaine Marmer. Elaine. Monier.
We don't get to choose. You always let us choose before.
Yeah, we're doing it a little bit different this time. Okay, you want to pick the next one? Helen Selentine. Okay, Helen, you get the gift from Archwell. Okay, and who gets the patriotic wreath? Sharon Kelly. Where are you, Sharon? Okay, you get a pretty wreath hanging on your door. Okay, now the eggs. Who's getting the eggs? Coming over for omelets in the morning. Ramona. There, is it Ramona or Ramona? Oh, Ramon, okay. All righty. And who gets the 4th of July basket? Okay, that person opted not to take a prize, but they did fill out the evaluation completely, so thank you very much. Linda Spalding. Where's Linda? Okay, you get to decorate for 4th of July. Oh, and how about the gift card from Nothing But Cakes? And this is from Sage 2 Living. Cindy?
I'll come to you.
Okay. And who's going to the prom? Somebody's going to the prom. Who is it? Mary Ann Whipple. You're going to the prom. Make sure you take a flyer so you know where it's at and what time. 5:30, Firefighters Hall. Okay. Well, thank you all very much. We want to give our panelists, Dr. Spivey and Maya here, a really big hand. They helped us with a lot of questions. Thank you so much. As you leave today, we appreciate you coming here. Make sure you turn in your name badges, and we would like to have some video reviews. Do you like coming to Savvy Seniors? Do you like what you're hearing? We have a camera set up, and we would like to tape you. You don't have to say it very long. You could go off for 5 minutes if you want, but if you just want to say how wonderful it is, or what you learned here, what you're going to take away from this, and how it's helped you, that would be awesome. And then we can put that on our website and social media to share with other people and invite them. So thank you so much for coming in today, and we hope you have a great month. Oh.
One last thing. So the person who won the ticket for the prom was not able to attend this Friday. So I drew another name, and we've got Susan Hertzler.
Susan.
All right.
You're coming to the prom.
Are you gonna be able to make it? It's this Friday.